Good morning. This is Dr. Beck here at Life Point Medical. It's December the 17th, 2020. And I want to say good morning to you and reassure you that we are here taking your calls and trying to get you taken care of. However, I do want to say we are grossly understaffed due to a myriad of issues like children out of school, people that we don't know, they might be sick, might not be sick, but we got to keep them away if there's any chance they could be sick. Stuff, and we're having to deal with all of that. Okay, so please just be patient with us, and we'll get to what you need if you call us. Okay, it's just we have to prioritize and do the right thing first, and but we'll get you taken care of from that standpoint. One little tip that I wanted to express it to everybody this morning, and this is something I talked to another person yesterday, and actually this has always been a hot topic in kind of medicine and figuring out what to do. Is should one person come to the visit or two people come to the visit? Okay, so the answer is I think 4 ears is always better than two when it comes to listening. Okay, so I do welcome a family member to come with a patient, particularly if the patient's sick or having issues or is vulnerable to memory loss or not remembering everything or older. I do believe that it helps if you have a family member come with you. There's a few things about that though. Number one, like I said, 4 ears is better than two is just a general principle. Number two, sometimes I tell people things and I'm pretty sure they don't hear anything else I say. And that's actually normal, okay? But everybody knows that sometimes I've got to deliver complex or news to people that they didn't want to hear or it's difficult for them to hear. And I've gotten a lot of practice in doing that, and I don't mind doing it, okay? Because that's part of my responsibility as a doctor is to help people through diseases and find diseases, help them through it, and hopefully prevent diseases and things like that, okay? But I do know that sometimes when people hear what I have to say, their mind is traumatized. They're emotionally traumatized by it, okay, because I'm saying something that they're not going to forget. So having another person there can help mediate some of that, and it also can help the other person to help get the information to that patient if I give them specific instructions and they didn't quite understand. Plus, the other thing is sometimes there can be an over response to what I say. In other words, I say, I think you might have X, Y, and Z. I don't know for sure, but I need to check and all this other stuff. Some people go home and get on Google and figure out that they may have a life-threatening disease or not, which I don't recommend you do. But anyway, it just can get all combobulated, particularly with the fact that there's a plethora of information on the internet now, where you can find out a lot of information about any disease. So, point is, if it can happen, we do recommend that you have another person with you when you come to a visit, okay, for information wise. The only other caveat to that is, if it's husband and wife, we can't see you at the same exact time, okay? And the problem is when I put a husband and wife in the same room and I try to see them at the same time, many times they get confused, I get confused, the nurse is confused about who's being seen, what are they being seen for, who's taking what, okay? And I've been in the room where the man and wife just husband and wife take over the conversation and just leave me out of it, and I'm sitting there for 10 minutes trying to figure out who's right, who's wrong, and stuff like that. So it's okay for your husband and wife to be in the same room while I'm seeing one patient, and then we just move to another room to see the other spouse and vice versa. And I know that sounds thing, but I'll tell you, we accidentally did it the other day. Somebody put a husband and wife in the same room, and I was so confused that I actually had to stop and say, okay, we've got to separate this because I can't tell who's doing what, and the computer doesn't help with that either, okay? So it's just confusing. So that's just a little hint, all right? Okay, let's talk about COVID-19. 103 cases reported this morning. I know that I spoke to maybe 10 or 15 people yesterday who were positive of COVID, okay? And it's definitely here in our community. It seems to be marching along here pretty steadily, and we haven't really implemented, I don't think, the stringent shutdown measures, okay? And I don't know if I even believe in those or not. However, we do need to, as a community, commute some of this responsibility to not spreading the disease. And the thing I want to reiterate, and this is again another issue because I'm having people yell at me because their test is negative, but they have symptoms, and I tell them, if you have symptoms, okay, you have to assume you've got COVID-19. That's just logic. You've got to. There's no such thing as a cold or a sinus infection in this day and time, or this year anyway, and hopefully it won't be next year. So, good luck. So anyway, just keep that in mind to help mediate. Okay, and people want to be tested and tested and tested, and I don't recommend that. Okay, if you've got symptoms, you have to assume you have COVID. After you've had the symptoms resolved and everything else, then you can get tested to see if you have it or not. And we still have our drive-through services. We're doing the rapid antibody test, okay? But we are searching for the rapid nasal test, okay? So we can start doing that one. I understand that it may be a better signal as far as your contagion or whatever, and I know a lot of organizations are now demanding this as opposed to the other things. So we are actively looking for the nasal PCR test, and we will provide that as a drive-through service as soon as we can get our hands on some of those kits. So bear with us on that, and we're going to be working on that for the next 2 to 3 days so we can maybe have them here next week. We can do the Nares test on anybody, and we do it on our patients all the time. However, you do have to be registered as a patient here in this office, and it does take anywhere from 24 to 72 hours to get the results back, which a lot of people want their results right then, okay? And we've been trying to work on that. A lot of times I'll do both. I'll do the rapid antibody test and the Nares test. So at least if the rapid antibody test is positive, they'll know for sure, and then they can confirm it with the Nares. But we also want to understand there's lots of false positives and lots of false negatives with all of these tests, okay? And there's a lot of confusion on whether which one is which. So you just have to, if you have symptoms though, you need to be safe and stay out of public's way. All right, this is Dr. Beck. I got to get back to work. Call me if you need us, and we'll get you taken care of. Have a great day.